Good morning, everyone, and welcome to the Independent Health Providers Safeguarding Forum Conference for 2023. So I'm Phil Winterbottom, the Head of Safeguarding for Signet Group and Chair of the Forum, and I'm delighted to be joined by David Wilmot this morning, who's the Executive Director of Nursing and member of the Executive Board responsible for safeguarding at Signet, who sponsor the Forum. So before I start with a little housekeeping, we just wanted to ensure that David had a chance to say a few words. I can see we've already got over 160 people joined, and more people kind of tumbling in through the virtual door every second, which is fantastic. It's lovely to see you all kind of saying good morning and introducing where you're from in the chat. Chances are, because safeguarding is a very small world, you'll start to recognise a few names, and some of you may have worked together before, so that's really lovely. But as I said, before we go into the housekeeping, just wanted to give David a chance to say a few words.
Good morning, everyone. Welcome to the Safeguarding Conference for 2023. Delighted to see all of you here today. I think one of the things that I just wanted to recognise was the real importance of this. Not just from a safeguarding perspective, but also the independent sector working together. Because I think it's only by working together that we share all of the great work, the great practice going on, the learning across our safeguarding forums. And I think if we think back a number of years ago, this would probably have thought impossible, but I think the work that Phil has done in driving this and also making us think about things in a different way and work together for the better of our patients and our service users and our residents. So I think anything where we can work together, I think, is a fantastic way forward. So I just wanted to say a huge thanks for all of the safeguarding teams across the independent sector, because we're all doing hard but fantastic jobs in keeping our service users safe. And enjoy your conference today, and I look forward to the rest of the day. So thank you very much, everyone.
Thank you so much, David. And it's I'll reflect on the kind of forum after the housekeeping, but just looking at the chat now with everyone joining from, we've got Tracy here from the MOD, we've got lots of specialist services, everything from kind of GPs to massive kind of national or kind of UK-wide providers. We've got, I can see representatives from a provider lead level all the way through to colleagues at sites, and it's lovely to have you all here. It really is. I just wanted to recognise that taking the time out of what is a busy week already anyway, because of the nature of our roles, to kind of engage in this learning opportunity is always really appreciated. We hope it is a nice chance to kind of hopefully be slightly distracted from the emails for the day. Take the time to reflect on some learning, and we've got learning this morning, and I'll run through the agenda in a bit. Then in the afternoon, we look at that kind of value of supporting our colleagues, and then we kind of round the day off with some kind of national updates as well. So finding the time to join learning events like this is obviously really valuable. Finding the time to be there and support each other is arguably the most valuable thing you can do. So if you do see colleagues in the chat box that you haven't reached out to for a while, or the names that you recognise, like nobody's going to mind kind of that little informal conversation off on the side and, oh, let me grab your email address and we'll catch up and stuff like that. Because if we've learned anything from the forum, it really is, and it feels like it's common sense, but you really do see the value of bringing people together when you actually take the time to bring people together. So we wanted to set up a forum, and we wanted to bring providers together in the interest of patient and service user safety. And crucially, it was really important for us to make sure that this wasn't a paid for membership thing. We didn't want any barriers at all. And talking about barriers, safeguarding colleagues will know that there shouldn't be any competition when it comes to safeguarding. I mean, if any competition, it's just to do it better. And the forum provides an opportunity for provider leads to come together, to learn from each other, to share challenges, but also to share examples of best practice. And in the past year, it feels like we've covered so much. It's everything from the Patient Safety Incident Response Framework, or PSIRF as you may know it, through to training requirements, all the way through to having the CQC join us to talk about safeguarding and closed cultures, which sadly is something we no longer have on the agenda today due to what can be described as kind of pressing safeguarding work that they're caught up in. And I'll explain what we're replacing it with on the agenda in a moment. And in terms of the forum, it was great that the terms of reference were co-produced with the NHS England Safeguarding Adults National Network and colleagues from the NHS England National Safeguarding Team. And that means that the forum has a kind of cemented relationship with that NHS safeguarding architecture, even though it's an independent sector forum. And as meetings are quarterly, I mean, we've only had 4 agended meetings since starting the forum in October 22, and we quickly introduced what are essentially interim open peer reflective spaces, and that's following feedback from members. And if we talk about members, we quickly gone from, it was around kind of 10 or 11 members in the first meeting to over 120 different members when I counted earlier this morning, representing different providers. And that's from smaller providers, as I said, all the way through to national providers, from mental health services to hospices, from specialist services and everything in between. And I think it's testament to the membership of the forum that we managed to sell out this conference weeks in advance of the agenda even being released. And that demand for the forum means that in 2024, we're considering kind of subgroups so that we can increase the membership for kind of service level leads. And that's because the terms of reference for the main forum is meant to be for the provider level leads. So if you are a national lead representing an independent provider with an NHS contract, do get in touch. My email's on the screen there. If you are a service level safeguarding lead and you think your national lead isn't a member, give them a nudge. And if you are a service level lead, do keep an eye out, because hopefully we'll be able to get those sub forums set up in the future. So let's take a quick look at what we've got in store for the day. We'll start our presentations with Kelly from FCMS, who'll talk about trauma-informed healthcare with adults facing complex and multiple disadvantages. Then Elizabeth will join us from Spectrum Community Health CIC to talk about their food refusal toolkit. Walter Lloyd-Smith and Heather Roach will join us from Norfolk Safeguarding Adults Board to talk about grasping the nettle, and that's exploring the lessons from the Causton Park Safeguarding Adults review. And with Phil unable to join us this morning, I thought I'd ensure you get your Phil fix, and I'll be talking about safeguarding mental health services. And we'll have a decent break for lunch, and Anne-Marie from Priory will join us to talk about their recent investments into training. I'll jump back in at that point and share some of the work we've done around our advanced training, and then keeping with that theme, St Andrews will talk about the safeguarding navigator role they've developed. And I'm delighted to say that before the afternoon break, Kate from Practice Plus will be wrapping up our staff development and support section of the agenda by talking about everything supervision. After the break, we've got James from Elysium sharing learning from a domestic homicide review. And then we're absolutely delighted that Kenny Gibson from NHS England will be providing us all a national update on safeguarding children. So it's going to be a busy day. So without further ado, let's get to our first presentation with Kelly Gorey from FCMS.